One of the most common complaints is shoulder pain. What can we do about it? Well, to begin, let's understand how the anatomy works, and we'll show you what different areas you can go after to try to relieve some of that tension. As you can see, the anatomy of the shoulder, it's very complicated. There are multiple different layers. There's muscles on the front, on the side, on the back. But where we will target is all of those areas and use the biozoom to help us find what areas need the most work. If you've been a baseball pitcher or had injuries or done any type of repetitive motion with your shoulder, you probably have some deep myofascial adhesions, also known as trigger points, hiding in there. We can use the biozoom with the blue tip and the setting frequency number 5 to both find them, break up the adhesions, promote circulation, and help you feel better. Let me show you what that looks like. We'll start with the blue tip. We'll turn to frequency number 5. Begin by comfortably holding the zoom unit with the arm in the neutral position. Begin with the front of the shoulder. This checks the bicep tendon, it checks the anterior deltoid muscles. Start with floating pressure. If you feel like you can tolerate more, put a little extra pressure. Once you've completed 10 to 15 seconds for an area, move to the outside, the middle deltoid area. Again, trying different angles, finding tension spots. Keeping the arm in a neutral position. Now what we'll do is change the position of how you are holding the zoom, and you may even switch arms. Either switch arms to reach the back, or grab it to get the back area of the muscles. If you have assistance, be seated, rotate slightly so they can see. Work the back of the shoulder to the back of the arm. Move slowly to the base of the trap. Work in slow circular motions down through the middle upper back. After you complete it in a neutral position, rotate more, Christian, your whole body. Grab arm, bring your arm across, opening up the upper back. If they can tolerate applying a little bit more pressure, getting down deep into those muscle groups. If it starts to bounce, that means you hit a bone. Just move on to the muscle tissue. Once you've completed that in a flexion, bring the arm up and back. Turn that way. Finish the session with front, middle, apply pressure on the middle. And finish loosening up the muscles on the posterior side of the shoulder, into the upper back, and into the trap. This one will extend 90 to 120 seconds. Do it 2 to 3 times per day. Complement that with stretching. If it's sore, use some ice. Other than that, that should get you heading in the right direction and get those baseballs and the golf shots flying farther.